Okay, so continuing on with our coagulation modifiers, we have the next three categories: antiplatelet drugs, thrombolytics, and antifibrinolytics. I can't say that word right, but you know what I'm talking about. Okay, here is what it looks like. Hopefully you can see that. You can always pause it and, I don't know, zoom in or something, but I am going to read you the information. So first, antiplatelets. These prevent platelet adhesion at the injury site. So this decreases the risk of fatal strokes. It's for patients who have had angina, myocardial infarctions, TIAs, or CVAs. Nursing implications are that there are a lot of drug-on-drug interactions and that you need to monitor abnormal bleeding. So the three different drugs we have here are acetylsalicylic acid, which is aspirin. I can never say that right. Clopidogrel, which is Plavix, and pentyl oxyfline. I don't know. Trintol is the brand name. So aspirin, Plavix, and Trintol. Let's start with aspirin. This drug inhibits platelet cyclooxygenase. That's like a fun word. Cyclooxygenase, which prevents the formation of TXA2. This is for stroke prevention, and it is available orally and rectally. Plavix is an ADP inhibitor, which makes platelets bind together. So this prevents the release of factor 4 and factor TXA2. So this is for the prevention of TIAs and myocardial infarctions. Adverse effects can include chest pain, edema, flu-like symptoms, GI issues, and rash. The nursing implications are that the patient needs to stop this drug 7 days before a procedure. Trintol increases red blood cell flexibility and decreases platelet aggregation. So it is an arterial vasodilator. This drug's adverse effects include GI issues, and nursing implications are that you can take it with food, but you do not crush this drug. This drug reduces blood viscosity. Remember, it's going to increase red blood cell flexibility. So over here for thrombolytics, this is actually breaking down the clot. So our teacher kind of likened it to like Drano, because you have a clot if you had a clog in a drain at your house, like with hair or, I don't know, kitchen scraps or something, you put Drano in it, and Drano is going to bust up that clot and let water flow. So this is like the body's equivalent of Drano. It's going to go into the vessel and bust up that clot and let blood flow could go through. So the drug here is Alteplase. This drug reestablishes blood flow. The brand name is Activase. I don't know, it's kind of like activate. Drano is gonna activate your drain again. So Activase is activating your vessels again. This can be used for patients who have had MIs, DVTs, PEs, occlusions at the shunts or at catheters, acute ischemic strokes, and arterial thrombolysis. That's a fun word. Adverse effects, wow, it's going to be bleeding, nausea and vomiting, hypotension, and dysrhythmias. And nursing implications are that you're going to monitor for bleeds, and you're going to try to prevent bleeding. So teaching them fall prevention. Hey, don't walk up those stairs if you're not really good at walking upstairs or whatever. Very, very smart stuff here. The next category are antifibrinolytics. I'm probably not saying that right, but I don't care. This promotes clotting. So this is going to make a platelet plug, and it's going to help it stick. So, I mean, I kind of think of these as like a tampon. I mean, you know what a tampon is and how it's going to stop the bleeding at that site. So if like somebody gets like a nosebleed, you stick it up there and it stops the bleeding. So I just think of that when I hear this stuff. So the two drugs are aminocaprionic acid, which is Amicar, and desmopressin, which is DDAVP. I have no clue what DDAVP stands for. We've talked about it in a previous chapter, but I don't remember off the top of my head. I just remember that those are the two antifibrinolytic drugs. These drugs can be used for systemic hyperfibrinolysis, which is an overall too much coagulation in the body, excessive bleeding from surgery, oozing from a surgical site, or hemophilia. The contraindications are DIC, which is disseminated intravascular coagulation, where the body is bleeding and clotting too much at the same time, and it's like you can't control the bleeding and you can't stop the clotting, and it's just a really bad situation. You'll hear it on like those medical shows where like the patient's in DIC and they're all like, they got to figure it out and fix it soon. Adverse effects are going to be dysrhythmias, orthostatic hypotension, and bradycardia. And there are some interactions which include oral contraception, lithium, epinephrine, heparin, alcohol, chloropromide, and flutocortisone. I'm going to let you see those drugs so you can see how to spell it. These are the interactions for this category here. So those are the 3 additional coagulation modifiers. Remember, we just talked about anticoagulants. And yeah, just remember, anticoagulants are preventing clot formation. Antiplatelets prevent platelet adhesion. Thrombolytics are breaking down the clot. Remember, this is like Drano. And then antifibrinolytics are promoting clotting. So there you go.